In a previous video, I shared how my brother missed several warning signs of high blood pressure signs that nearly led to a stroke. Many of you reached out, saying you'd seen similar symptoms in yourself or a loved one. So today, I want to go one step further. In this video, we'll explore 3 daily habits that can help lower blood pressure naturally, strengthen your heart health, and support long-term senior wellness. According to the National Institute on Aging, more than 60% of older adults live with hypertension, and many don't even know it. Left unchecked, it increases your risk of stroke, heart attack, kidney damage, and cognitive decline. But here's the good news. You can take control without relying solely on medication. These 3 habits are backed by research from Harvard Health, the American Heart Association, and the Mayo Clinic, and they've helped thousands of older adults achieve better blood pressure control through simple, consistent lifestyle changes. And I'll reveal one breathing technique in Section 2 that's clinically shown to lower systolic blood pressure by up to 9 points. So be sure to stick around. And if you find videos like this helpful, don't forget to hit that subscribe button. It really helps our community grow and stay healthy together. Habit number 1. Daily walking. Small steps, big impact. Let's begin with one of the simplest yet most powerful habits to help lower high blood pressure naturally: daily walking. After that dangerous stroke my brother suffered, he began making serious changes to his lifestyle. This was actually the very first habit he committed to. His doctor told him that small, consistent changes could have a major impact, and walking was something he could start right away, even without adjusting his medication. At first, he doubted whether walking alone could make a difference, but the science says otherwise. A major study published in the Journal of the American Geriatric Society followed more than 1,200 older adults and found that those who walked 30 minutes a day, 5 days a week, saw their systolic blood pressure drop by an average of 8 mm Hg. That's a significant reduction, equal to what many people get from a first-line blood pressure medication. And there's more. Walking helps your blood vessels become more flexible and less resistant to blood flow. It increases the body's natural production of nitric oxide, which relaxes arteries and improves circulation. Over time, this helps reduce the strain on your heart and lowers overall blood pressure. Plus, it supports healthy weight loss, boosts oxygen delivery to tissues, and improves cholesterol levels, all of which are important for senior health and healthy aging. For my brother, the key was starting small. He began by walking just 10 minutes after lunch and dinner around the block. After a few weeks, he was up to 30 minutes a day, and he felt more energetic, slept better, and most importantly, his numbers started improving. Within 3 months, his systolic pressure had dropped by 10 points. If you're just beginning, know that you don't need to do it all at once. 3 short walks of 10 minutes each day work just as well as 1 continuous walk. If you use a cane or walker, or have joint pain, you can still benefit from slower paced or seated movement, even gentle chair yoga. And for tracking progress, a simple pedometer or app like Pacer or Fitbit can keep you motivated. A goal of 5,000 to 7,000 steps a day is excellent for most seniors, but even adding a few hundred steps more than yesterday is progress. Just be sure to listen to your body. If you feel dizzy, have chest discomfort, or feel short of breath, pause and talk to your doctor. You can also ask them about a 6-minute walk test, which is often used to assess how your heart responds to physical activity, especially useful if you're managing existing conditions. So, what about you? Do you have a favorite place to walk: the park, a shopping mall, or just laps around your home? Share it in the comments. Your suggestion might be exactly what someone else needs to get started. And as promised earlier, up next is the breathing technique my brother practiced, alongside walking, a simple habit that helped lower his systolic blood pressure by over 9 points and became a calming, Heart-healthy part of his daily routine. Habit number 2. Slow breathing. Gentle rhythm. Strong results. Have you ever noticed how your breathing changes when you're stressed or anxious? After my brother's stroke, one of the things he struggled with most was that constant, uneasy feeling like his body was always on alert. Even when his blood pressure monitor showed better numbers after walking regularly, he'd still feel his heart racing before bed or right after waking up. That's when his doctor introduced him to something incredibly simple, yet surprisingly powerful: deep breathing. At first, he was skeptical. Breathing? Really? But the science was hard to ignore. A study published in the Journal of Human Hypertension showed that practicing slow breathing around 6 breaths per minute for just 15 minutes a day lowered systolic blood pressure by an average of 9 millimeters Hg in older adults. That's a meaningful drop, especially when you're managing hypertension without wanting to increase medication. So what makes breathing so effective for blood pressure control? It activates your parasympathetic nervous system, which is the body's natural calming mechanism. It tells your heart rate to slow down, your blood vessels to relax, and your stress hormones to back off, all of which support a healthier cardiovascular response. My brother made this a part of his daily routine. He would sit quietly each morning before breakfast and spend about 10 minutes focusing only on his breath. He followed a simple pattern his doctor taught him. Inhale through the nose for 5 seconds. Exhale gently through the mouth for 5 seconds. Repeat that rhythm for 10 to 15 minutes. Sometimes he'd use a free app like Breathe Plus to help keep the timing steady. Other days, he just listened to calming music and followed his internal rhythm. After 2 weeks, he noticed he was falling asleep easier, and he no longer felt that tight pressure in his chest in the middle of the night. His blood pressure readings in the early morning, usually when it had been highest, started to level out. For some older adults, especially those with mobility challenges or lung conditions, this can be done lying down or in a recliner. And if you're someone who likes tools, devices like Respirate, an FDA-cleared breathing assistant, have been shown to help seniors lower high blood pressure over time. Of course, this habit isn't for everyone. If at any point you feel dizzy, short of breath, or uncomfortable, stop and talk to your doctor. And be sure to ask whether slow breathing could be safely added to your daily routine, especially if you're already managing stress, sleep problems, or anxiety. Breathing exercises can be a small habit with a big impact, not just for lowering blood pressure, but for feeling more at ease each day. This kind of tip is worth passing on. Share this video with someone you love, a friend, a neighbor, or a family member, because sometimes one small change can lead to a much healthier life. Now, in the next section, I'll walk you through the eating pattern my brother turned to after his recovery, a change that helped him lower his blood pressure by more than 10 points and completely transformed the way he thought about food and health. Habit number 3. Diet and smart nutrition. Changing the way we eat can feel overwhelming, especially later in life. But after the stroke, my brother realized that certain foods were making his condition harder to manage. His doctor introduced him to the DASH diet, short for Dietary Approaches to Stop Hypertension, and it changed everything. This isn't a fad diet. It's a long-term eating pattern that's been studied for decades. According to the National Heart, Lung, and Blood Institute, following the DASH diet can lower systolic blood pressure by 8 to 14 points, especially in older adults with hypertension. That's a major improvement, backed by science from the Mayo Clinic, Harvard Health, and countless clinical trials. So, what exactly does the DASH diet look like? It's built around whole, nutrient-rich foods, fruits, vegetables, whole grains, lean proteins, and low-fat dairy. It cuts down on sodium, saturated fat, and added sugars. And it adds in key nutrients like potassium, calcium, and magnesium, all known to support healthy blood pressure. For my brother, the first step was small. He started by cutting down on processed snacks and salty sauces. He swapped deli meats for grilled chicken, replaced white bread with oats or brown rice, and added a side of steamed greens to each meal. Within weeks, not only were his blood pressure readings improving, but he also had more energy and fewer blood sugar spikes after meals. Here's a simple breakdown his nutritionist gave him. 4 or 5 servings of vegetables per day, like spinach, broccoli, or carrots. 4 or 5 servings of vegetables per day, like spinach, broccoli, or carrots. 4 or 5 servings of fruit, such as apples, bananas, or berries. 2-3 servings of low-fat dairy, like yogurt or skim milk. Less than 1,500 milligrams of sodium per day. Check labels carefully. 2 or fewer servings of red meat per week. Use herbs and lemon instead of salt to flavor food. And the key was not perfection, it was consistency. A few better choices at each meal, day after day, added up. The diet helped him lose a few extra pounds too, which further supported his blood pressure control and heart health. This way of eating also lowered his cholesterol and improved his digestion, all common concerns for adults over 60. And the best part? He didn't feel like he was on a diet. It was just a healthier way to eat and live. For those with dietary restrictions or limited access to fresh food, there are still options. Frozen vegetables with no added sauces are a great alternative. Low-sodium canned beans, brown rice, eggs, and even plain oatmeal can be dash-friendly on a budget. Anyone considering this diet should speak with a doctor or registered dietitian, especially if you have kidney issues, diabetes, or are already on multiple medications. Making these changes can feel like a big step, but it's one that pays off. And just like my brother, anyone can begin with small changes, one meal at a time. Already following a similar eating plan? Know any low-sodium recipes or tips that make healthy meals easier? Share this video with someone who's trying to eat better too. It might give them a place to start. To wrap up, my brother made just 3 daily changes after his stroke: walking regularly, practicing deep breathing, and following a heart-healthy eating pattern. These simple habits helped lower his blood pressure, gave him more energy, and helped him feel in control again. High blood pressure may be common in older adults, but it doesn't have to define your health. Unhealthy habits like too much salt, long hours of sitting, or chronic stress silently wear down the heart. Replacing them with small, consistent actions can make all the difference. A conversation with your doctor is always a smart next step. Ask about your current numbers, whether lifestyle changes could reduce your medication, and what small steps fit your personal health status. Regular checkups, basic blood tests, and honest questions go a long way in preventing future complications. What's one change you've made after turning 60 that's helped your health? Share your story in the comments. Someone else in our community may need that inspiration today. And if you found this video helpful, please take a second to like it and subscribe to the channel. It's a simple way to support this content and make sure more people in our age group get practical, reliable tips for healthy aging. This video is for educational purposes only and should not replace advice from your healthcare provider. Always check with your doctor before making changes to your medication, diet, or exercise routine. Thank you for being here, and take good care of yourself. You deserve it.